The doctor is in the house. Thank you for joining me, Dr. Vin Gupta. He's here today to answer your questions about the vaccine. So the first question I will go ahead and throw to you is around allergies. It's, again, from one of our viewers. For those with food, drug, other allergies, what's the best course of action when deciding whether to get the coronavirus vaccine?
Maria, good evening. Here's the recommendation. I would say, because there's a lot of confusion on this specific topic, if you've had dizziness or if you felt like you're going to be fainting, if you had pale skin, if you've had nausea, vomiting, or diarrhea, a rapid pulse or shortness of breath, any of those symptoms, hives, after food, after a medication, after a vaccine, talk to your clinical provider, whether it's a doctor, nurse practitioner, you name it, before you get this vaccine. That's a severe allergic reaction. I would want you to talk to your provider before you got the vaccine, just to make sure you're all clear. That's all.
And I think this is a question that many people are asking. Can you still get the vaccine while you have COVID-19? Will it help lessen the symptoms, or will it be even effective?
Now, this question hasn't been studied because the individuals who were in any of these phase 3 trials, Moderna or Pfizer, didn't have COVID-19 to begin with. So the answer is we don't really know. My gut tells me that if you're asymptomatic with COVID-19, it's not going to affect you. You still might have some mild symptoms. If you're symptomatic with COVID-19, I'd hold off, because there's a chance that you might develop more muscle aches, a low-grade temp. It just might make you feel slightly more crummy. So I would hold off in that case if you're symptomatic with COVID-19. But this is not an area that's really been explored. So I would say asymptomatic COVID-19, go ahead. Symptomatic COVID-19, I'd pause.
Take a listen to one of our viewers, Amaka, one of the questions that she had.
Hello, my name is Amaka, and my question is, without clear leadership, how would you break down the American citizens into groups to get the vaccine first to make the most significant and economic and emotional impact? That is, of course, after the hospital employees and nursing homes. For example, I am a psychiatric nurse practitioner who can work remotely. I obviously would be considered a general population and behind the K-5 teachers and grocery employees. Thank you. Dr.
Gupta, what do you say to her?
That's a vital question. Thank you, Amaka, for asking it. I would say we're going to get guidance on this. So the Advisory Committee on Immunization Practices that advises the CDC is going to be providing clarity. I'll say right now, before they do that, that anybody over 65 should be prioritized in that next batch. If you're a grocery store clerk, hairdresser, if you're a barista, we need to be expanding our definition of what's an essential frontline staff here to people that help run our economy, that are interfacing with Americans to some degree right now. So I would that a broadened definition, a UPS, FedEx, Amazon driver, you name it. Those are the individuals. USPS. That's who's going to be in that next group.
And any recommendations for women who may be pregnant or breastfeeding?
So the American College of Obstetricians and Gynecologists has been pretty clear. They said that, and very rightfully so, that we're finding pregnant women with COVID-19 are at an increased risk for a bad outcome, meaning they're more likely to see me in the ICU and my colleagues. So they should absolutely be prioritized in that next group, harkening back to Amika's question. In that next group, pregnant women as well should be offered that vaccine, be given priority access. There is some disagreement here in Britain and Canada. They have slightly different approaches. But here in America, there's this emerging consensus we're seeing that indeed pregnant women should be getting that vaccine as soon as possible.
And I want you to take a listen to this soundbite, because I think this is where we know there may be confusion. There's several vaccines out there on the market. Listen to this soundbite to figure out which one do you take and to make sure that you take both.
I'm Marlena Vega from Bartlett, Tennessee. I have 4 questions. 1, what protocol is in place to ensure both the vaccines you must take will be from the same manufacturer? 2, who will determine which vaccine you get? Can you choose? 3, will there be a nationwide system in place to track who, where, when, and which vaccines will be given? 4, what documentation will people be given as proof of their vaccination? Thank you.
Dr. Gupta?
It's all great questions. So answering the last one first, you're going to get a vaccination card. For example, those who are going to get the Pfizer vaccine will get a vaccination card day one, they're going to it'll note when they got that day one vaccine, then 28 days later when they got that second dose. So you're going to get some sort of vaccination card to demonstrate that you indeed did get a certain type of brand. In terms of what type of brand, there is no clear guidance here about whether or not a certain specific type of pharmaceutical vaccine is better suited for one type of demographic versus another. Some people are, for example, concerned that vaccines built on other viruses, say a weakened virus or an inactivated virus platform like the Johnson & Johnson vaccine or the AstraZeneca vaccine, is that safe to be giving to those who are older or with pre-existing conditions or with an immunocompromised type condition? The answer is we don't know, but all of these vaccine platforms are likely to be safe for everybody is the going thought here, so that basically get the vaccine that is first available to you is the current thinking here. But we're going to learn more in the coming months. We'll be a little bit better nuanced here. In terms of an infrastructure, an information infrastructure to track who gets that day one vaccine and then when are they due for that next shot, local and state officials in all the 50 states across the country are working on actually building that out. So that's going to be a local and state effort, not a national effort.
So for folks that say, wait a second, you're going to give me a card and I'm supposed to not lose it, snap a picture of it. That's what I recommend. So the last question for you. I am a COVID long hauler who still experiences chronic fatigue, malaise, and the inability to concentrate, body aches, neurological symptoms, and intermittent chills, and a sore throat every other week or so. I'm wondering if the vaccine is safe to take and will it exacerbate the long COVID symptoms that I'm still experiencing?
Long COVID is something that I wish we could talk more about. It's a serious ailment, and we need to care for our patients who've recovered from this virus, who are experiencing the symptoms that were just outlined. There's a lot more people out there that have that exact same symptom profile, slightly different symptom profiles. The going thought here is, again, there's a lot more that we need to learn about this space because people with long COVID syndrome were not included in some of these phase 3 trials. Having said that, there is no reason why you should not get that vaccine if you've had COVID-19. There is no thought here that getting the vaccine will exacerbate any of those symptoms. You should absolutely get it because these mild side effects are far better to have than actually experiencing the disease once again.
Dr. Vin Gupta, thank you so much for answering these questions.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.